Okay, now we're going to talk about diseases and conditions of the female reproductive system. The female anatomy, okay? So as you can see, we have the fallopian tube, the uterus, and this portion right up here, the top, is called the fundus of the uterus. Okay? So the myometrium is the muscular portion of the uterus, and the endometrial lining, or the uterine lining, okay? That's the inside of it. You have the cervix, the vagina. Okay, now in here, this blue area right in here is called the cul-de-sac. All right. Let's see, and then right here at the opening, okay, are two little glands, and those are called the Bartholin glands, and they produce mucus that lubricates the vagina. Okay, and this area right in here is called the perineum. Now, you've heard, we're going to talk about the vulva, and this is a general term referring to the external female genital organs. It includes the mons, labia minora and majora, the clitoris, urethral meatus, and the opening of the vagina. Signs and symptoms of reproductive tract disorders in females. You have abdominal pain, fever and malaise, abnormal vaginal discharge, burning or itching, pain during sexual intercourse, any change in breast tissue, or abnormal discharge from the nipple. And we're going to talk about these female reproductive diseases. Okay, disorders associated with menstruation. We have PMS, which is premenstrual syndrome. This is a constellation of physical and emotional symptoms that may appear shortly after ovulation and are relieved by the onset of menses. Okay, they have amenorrhea, which is the absence of menstruation. Now, primary amenorrhea is the absence of menarche, which is the initial menstrual cycle, beyond age 16. Secondary amenorrhea is the absence of menstruation for 6 months in a female who has previously had regular periodic menses. And dysmenorrhea is painful or difficult menstruation. So primary dysmenorrhea is not associated with any identifiable pathologic disorder, and secondary dysmenorrhea accompanies some underlying disease condition. Ovarian cysts are fluid-filled, semi-solid or solid masses. They originate in the ovary, and they are derived from ovarian follicles and the corpus luteum. Endometriosis is characterized by extrauterine endometrial tissue. It's chronic. It's thought to be due to retrograde flow during menses. Blood can regurgitate out of the fallopian tubes and into the abdominal cavity. Pelvic inflammatory disease is an infection of a woman's pelvis. It includes the fallopian tubes, ovaries, and surrounding tissue. It's caused by an ascending bacterial infection, often an STD, can cause septicemia and possibly infertility, and it's associated with IUDs, the intrauterine device. Uterine Leiomyomas, these are another name for them are fibroids, benign tumors of the smooth muscle within the uterus. Most fibroids are asymptomatic and do not require treatment. Okay. Now, it's hard to read these, but the intramural are those within the muscular uterine wall. Okay. We have the submucous. Okay. So that's this one right here. This grows under the mucosal layer of the uterus, which is the innermost one. We have what they call a pedunculated. Okay. And that it's on a stalk. Okay. The substernus lies under the serosa, or the outermost layer of the uterus. Okay. And then we have vaginitis is an inflammation and or infection of the vaginal tissues. It's most often results from STDs or yeast infections such as Candida albicans. Lactobacillus is not sufficient to keep Candida species in check. Now, the toxic shock syndrome, this is an acute system infection excuse me, with Staphylococcus aureus. Streptococcal, or you can have streptococcal toxic-like syndrome. Uterine prolapse, the uterus sags from its normal position and moves partway or all the way into the vagina. This condition usually occurs after menopause when reduced hormone levels weaken the ligaments. A cystocele is when the urinary bladder is displaced and protrudes into the anterior wall of the vagina. Okay. A rectocele is when the rectum protrudes into the posterior wall of the vagina. Okay. Now, these are conditions and complications of pregnancy. You can have a spontaneous abortion, which is also called a miscarriage, naturally occurring loss of a fetus before the 20th week of pregnancy. There's 3 classifications: a missed miscarriage, no tissue passed, and incomplete, some tissue has passed, and complete, all the tissue has passed. There's a higher incidence in first pregnancies. It's caused by chromosomal abnormalities, defective development of the embryo, faulty implantation of a fertilized ovum, placental problems, maternal infections, hormonal imbalances, trauma, and then unknown causes. An ectopic pregnancy. This is when the fertilized ovum implants and grows outside the uterus. This is 2% of all pregnancies happen like this. Occurs most often in the fallopian tubes. Can occur in the ovaries, abdomen, and lower part of the uterus, which is the cervix. This is a problem because it can tear or rupture the fallopian tube, which is not designed to accommodate a growing embryo. Can lead to severe internal bleeding. A guy that I work with, his wife almost died with this. So it was really bad. She was bleeding a lot. Preeclampsia. It's also known as PIH, pregnancy-induced hypertension. This is the non-convulsive form of PIH. Toxemia is a serious disease of pregnancy characterized by hypertension and proteinuria. If a seizure occurs, this is termed eclampsia, and this is the convulsive form of PIH. This is a hypertensive disorder that may develop during the 3rd trimester, more likely to occur in women in their first pregnancy. Abruptio placentae. This is a premature detachment of a normally positioned placenta during pregnancy. The placenta is derived from maternal endometrium and the chorion, which is the outermost membrane that surrounds the developing embryo. It's a vascular organ that forms within the uterine wall. It provides nutrition and oxygen to the developing embryo. So in abruptio placentae, the fetal blood supply is compromised and fetal distress develops in proportion to the degree of placental separation. Placenta previa. The placenta covers the opening to the cervix. A partial previa is the majority of the placenta is away from the opening. In a complete previa, more central position of the placenta covers the opening. The placenta attaches to the uterine wall in the lower portion of the uterus and covers all or part of the cervix. Hydatidiform mole. This is an abnormal proliferation of the placental tissue. Has a cluster of grapes appearance on the ultrasound. Okay. And then we're going to talk about diseases of the breast. So this is breast anatomy. They're also called mammary glands. The physiological function of breast is lactation, and it's under the control of prolactin. Now, the lactiferous duct, These are milk-carrying ducts, and they carry milk to the opening, which is the nipple. The Cowper's ligament right here that supports the mammary gland. The breast lobule, which are these. These are milk glands that develop in response to ovarian hormones during puberty. During puberty in the female, breast tissue responds to the release of female sex hormones, estrogen and progesterone. Estrogen stimulates formation of additional ducts, elongation of existing ducts, and formation of a system of milk-secreting glands. Progesterone stimulates lobule formation. Fibrocystic breast condition. It's common, benign, and you'll have single or multiple fluid-filled cysts. It rarely occurs after menopause. A generalized diagnosis for a condition in which there are palpable lumps or cysts in the breast that fluctuate in size with the menstrual cycle. Causes are linked to the hormonal changes associated with ovarian activity, and there's a tendency to run in families. Mastitis. And it's an inflammation of the breast tissue. The infection is in the breast tissue, not the milk. Puerperal mastitis that may happen to women who breastfeed their babies. Now, puerperal is the time from when you give birth to the baby and up to 6 weeks after. A fibroadenoma of the breast. This is non-tender, benign tumor of the breast, and it's hormonally responsive. And the last slide is Paget's disease of the breast. This is an uncommon type of cancer that forms in or around the nipple. It's almost always associated with breast cancer. There are two theories on this. One, the Paget cells, which are the cancer cells, break off from a tumor inside the breast and move through the milk ducts to the nipple. And the second theory is that skin cells of the nipple spontaneously become Paget cells. And that's it. Thank you.